All right. Good evening, everyone. My name is J.C. Foltz. I'm the Public Information Officer for the Office of the Illinois State Fire Marshal. We appreciate you guys joining us here this evening for our forum. If you miss any of this forum, I'm recording this tonight. I'm going to put this on the Office of the State Fire Marshal's Facebook and Twitter pages. Probably won't come up until tomorrow. It takes a while to get the recording in and then get it uploaded. So bear with us on that. But again, if you miss any of this tonight, this is going to be available on our Facebook and Twitter pages. I'm also going to make this available at sfm.illinois.gov. Just as a reminder tonight, if you have any questions for any of our presenters, you can email me at jc, the two letters jc, .fultz, F-U-L-T-Z, at illinois.gov, or you'll notice on the side of your screen where it says chat, you can hit the chat button. You can send a question to me in the chat feature, and we'll answer those questions after everyone's presentations this evening. So again, you can email me at jc.fultz, F-U-L-T-Z, at illinois.gov, or you can hit the chat feature on the bottom right of your screen and send your questions in. So without further ado, I'm going to introduce State Fire Marshal Matt Perez. Fire Marshal, take it away.
Hey, welcome to Guaranteed Rate Field. Going to be the home of the next World Series champs, Chicago White Sox. Looking forward to tonight's game. I know JC's loving it. But anyway, hello everybody, and thanks for joining us this evening. And I hope you're all taking care of yourselves and staying healthy. This evening, we're proud to bring together the representatives from the Illinois Fire Chiefs, MAVIS, Illinois Fire Service Institute, and the Associated Firefighters of Illinois to speak to you about the importance of being prepared to respond to a COVID outbreak in your department. There have been several departments in Illinois, some large and some small, who have had to find alternative resources to deal with staffing level shortages. This, combined with stations being out of service for decontamination, has pushed them beyond their capacity to staff equipment and provide fire protection in their areas. Although each department or district is unique, having and being prepared to implement a recently updated continuity of operations plan is vital to maintaining service in your area. This plan should address your internal response to an event, as well as how to request additional resources from local mutual aid and beyond. Illinois is blessed to have the best mutual aid body system in the nation, but we need to know how and when to utilize it. The speakers that follow will provide you with what you need to know to build a solid plan and be prepared in case of a COVID outbreak happens in your department. With that, I'll turn it over to Chief Don Chevlin, First Vice President and soon to be President of the Illinois Fire Chiefs Association. Don?
Thank you, Marshal Perez. Appreciate it. As the Marshal said, my name is Don Chevlin. I am currently the First Vice President of the Illinois Fire Chiefs. I'm honored to be representing the Chiefs Association this evening here on this forum. I guess my point would be no matter how large or small, whether you're a career, combination, part-time or volunteer, all of us are feeling some effect of this COVID pandemic. And I'm sure none of us expected the challenges we face today at the beginning of 2020. Just as well as we think out a pre-plan or we think out a comprehensive capital replacement program for our departments, we must also prepare to maintain the boots on the ground, our firefighters. Having a comprehensive and current continuity of operations plan, or a COOP, will help us identify critical functions, including personnel. There are two key questions for a COOP. The first is what operations performed by our departments are essential, and secondly, what resources are required to continue those essential resources, which would include personnel. I encourage all of us to review our COOP. Start by reviewing the effects that different levels of staffing shortages will have on your operations. Then reach out to our neighboring departments and districts and see what we can do to help each other in the event of a COVID outbreak shortage that affects our staffing. If you do not have a COOP, now is a great time to create one using the tips shared in this forum. On behalf of the Chiefs Association, I want to thank all the hardworking and dedicated firefighters and EMS personnel in this state. And I encourage everyone to stay safe and stay well. Goes back to, I believe,
Thanks, Chief
JC.
Shepard. Yeah, thank you, sir. We appreciate it. We appreciate you joining us this evening, and we hope that you stay safe and well as well. So I wanted to remind everyone, if you just joined us a few seconds ago, that if you have questions, please send them to myself, jc.fultz@illinois.gov. That's FULTZ. Or you can send us moving on now. I would like to hand and let you take it. Give me just 1 second and let me get it down to you there really quick. So bear with me for just a second, Chief.
All right, thanks, JC. I think you were froze a little bit there on that handoff to Mavis. My name is Kevin Line, Operations Section Chief with Mavis, Illinois, and also happy to participate in this forum tonight with our partners around the Illinois Fire Service organizations. At Mavis, we understand the impact of COVID. For the past 190 days with Mavis, Illinois, of our sustained operations to support the COVID-19 line of effort. Most of our focus has been on working with departments and divisions to provide Western shelters and generator light towers out at hospitals and care facilities. It's just been recently that we've had departments that have shown positive numbers with COVID that has impacted their ability to provide their regular day-to-day service. So kind of on the Mavis side of that, we look at the normal mutual aid process, which is used countless times every day across the state. We're familiar with that. For an incident, we look at a short-term coverage at stations, a change of quarters during a box alarm, but the COVID impact to the mutual aid is a little bit different. What we've seen with a career fire department in Southern Illinois and even a volunteer fire department in Western Illinois is they did not have the staffing because of COVID positive people or personnel on quarantine to provide the regular fire service. So that mutual aid process of just responding to a fire, mutual aid or automatic aid or an EMS call was different because we're looking at providing coverage on a 24-hour basis to a community. And in discussion with those organizations, that is something that they really hadn't planned before. So this impact could be to a career department with multiple stations. We've also saw that in the outside the greater Chicago area where there was a agency that had one shift that was impacted due to an exposure for a period of time. Whether you're a combination department, volunteer department, part-time agency, and your inability to staff your own rigs for a short period of time, your response levels needs to come back to your community planning and fire department planning for that. As was mentioned before, we need to ID our coverage and staffing needs. The Mavis MOU that the agencies in Illinois have signed allowed for mutual aid coverage, not just necessarily for response to a fire incident, but it could allow for that response of a division providing, a fire department within a division providing a resource to another fire agency for that 24-hour period of time, and potentially another department supporting that. In the event that that situation comes in, regardless of the plan that you have, I would offer that you would outreach to Mavis. Around the state, we have the various regions, and everybody hopefully is familiar with their operations branch chief. If not, you can reach out to Mavis. We can provide that contact information for you. As part of that, when you're starting to identify that there's a deficiency or you may be impacted to provide that regular service for a period of time, we can help coordinate that conversation with your division president. Your division president and executive board that oversees your division and the departments within it may be able to provide some assistance, and we can engage that conversation right at that divisional level. And if needed, as was the case in Southern Illinois, with adjoining departments with two of our divisions, is we can reach out on an interdivisional response for that. But part of that goes back to that needs assessment is what is your need, not necessarily, maybe your regular staffing coverages, but what is that need that you need to do to provide that service to the community? If we can't get the resources to you through your divisional resource or interdivisional resource, there's opportunities to go through the state's disaster declaration process and request help through the state. JC, I'm going to put that just a little flyer that the IEMA has on the screen right now, and just to kind of show people that's there. So this flyer is available at the IEMA website. We'll make it available for there. It talks about the disaster process. And on page 2, it talks about the local response and what needs to happen in the event of an emergency. And I am going to stop sharing this screen and turn that back to the big crowd. So in the event that you have a disaster that you can't provide resources for, you've exhausted your local capacity and don't have the resources to assist, and you're looking for assistance, not necessarily to support your normal coverage levels, but maybe the coverage levels that you deem necessary, you can reach out to your county EMA coordinator and request assistance. That would be part of that normal disaster declaration process. And that's similar to what many fire departments and agencies have done in requesting PPE in the early days of the COVID crisis. So at the county level, there'll be some involvement with MABUS, with the division presidents and the branch chiefs to help identify that there are truly no resources available within the division or within the region to help. If the county EMA accepts the premise that a community is impacted and it can no longer help itself and the county cannot provide resources, then the county can run that request up through IEMA, similar to a lot of the other resource requests that have taken place that year. In conversation with IEMA on this disaster request process is they would reach out back to MABUS, we'd reach back out to the county, we'd reach back out to the fire department. So this is not a process that would take place in a vacuum. And that coordination with the fire department is something that would be nice to evaluate or critical to evaluate. And if this process was to be approved by IEMA, we need to determine what resources needed. If it's a fire or EMS resources, there's different avenues to provide that assistance. Are we looking at a single resource as a fire engine? We wouldn't necessarily be looking for a strike team of multiple fire engines, nor maybe a task force that would be engines, truck, squad, command vehicles with some EMS assistance. So for requesting assistance, if we need a fire company there, one of the things that IEMA is going to ask us for is, are we looking for a NIMS type resource, which is the typical model that would be used to provide those resources at the state level. An example of that would be a fire engine in a NIMS typing has 4 personnel. And one of the challenges that may be on a fire department that would be looking to provide this assistance is they may have a tough time providing a fire engine with 4 personnel when their daily staffing levels may only be at 3 personnel or 2 personnel. So if this progresses to the level where IEMA is going to get involved to provide those resources, is we really need to know those that resource type that the community needs and for how long that period of time it's needed for. If a fire agency is going to support another agency when there is a state disaster or a declaration or mission tasking for that, then the fire department that sends the crew on the reimbursement side is going to pay that backfill overtime to that crew that's sitting in another community's fire station. Then that fire agency would await for reimbursement from the state. There could be a delay of up to 6 to 9 months for that reimbursement for the fire department from IEMA for that resource that they put in, and that's similar to the reimbursement process that took place during the 2019 floods. One of the considerations, if you're a fire agency that's looking for outside resources, is that depending which region or part of the state you're in, you may not find other fire agencies that are readily willing to assist because they may already be financially impacted from the COVID financial shutdown that took place. And they may not have personnel readily available because they also may be impacted with COVID positive personnel or people that are out on quarantine. In the event that there is reimbursement that's needed, the same forms that many fire agencies that are probably represented this evening that have supported the COVID effort with Western Shelters or Generator Light Towers, those same forms are available and MABUS can assist on that process. If a fire agency is supporting another fire agency, a consideration that may be involved is that they're sending personnel into a COVID hot area, and that may impact or their personnel may be exposed, which may be a consideration for or a reluctance for an agency to provide help. Your preparation as a fire agency is really critical to be able to provide the emergency service that your community needs. When you're requesting help for that during the normal mutual aid process, that help is usually given. We know that sometimes a fire department may not be available on a box alarm the dispatch center knows to skip and goes to the next fire department. If you're requesting resources to help you because you're impacted by COVID, we're here to help. There's a process in place. We can provide more information for that. But understand that your neighboring fire department may not be in the ability themselves to be able to provide that need for a day or for 2 days or 3 days. We may have to go outside that region. And again, Mavis is here to assist in that way. Back in August 13th, Mavis sent out a letter stressing the importance of planning, especially on the continuity of operations. Since that time, IFSI has received many questions on what a COOP plan would be. And Mavis has worked a little bit with IFSI on that plan. And to discuss the COOP planning further, I'd like to turn over the conversation to Colonel Royal Mortensen, Director of the Illinois Fire Service.
Good evening, everyone. Can you hear me?
Gotcha, sir. Go for it.
All righty. I find myself here this evening listening intently, but also in a position that I suspect many of you have been in throughout your professional life, and that is I'm the front man for JP Moore. My sole purpose here is to kind of give you a little bit of background on what JP is going to talk about, and really just kind of illustrate the point that, you know, hopefully everybody here understands already that the Institute is ready to do whatever we need to do to support you and your first responders. Obviously everybody knows in early August, Mavis issued their all division notice about the requirement for a COOP. By sheer coincidence, later that month, somewhere around the 18th, I believe it was, JP was visiting with Mavis to talk to them about our active shooter incident management program that we've developed and put together and want to start using, getting people to start to participate in. And he mentioned to Mavis, to Chief Line and Glenn, that JP had been receiving a lot of calls about COOP plans and templates and basically reactions to the 13 August all division notification. In typical fashion, JP immediately reached out to me and said, "Hey, I think the Institute can help here. As the NIMS director, this is probably, makes sense for it to be in our ballpark, in our strike zone, to be able to put a template together for a COOP that specifically deals with staffing and resourcing," which is really what the people that were calling JP and asking him about what we may have had available as our NIMS director is what was principally what they were talking about or asking about. He briefed that to Glenn and his team, and Glenn quickly, which really makes me feel good. Glenn very quickly glommed onto the opportunity to work together for Mavis and IFSI to work together, our staffs to work together and put this template together. It's a classic example of what we've all been living and experiencing since Matt took over as the fire marshal, and that is people working together. It's not to be taken for granted that we consistently work together to solve problems, and this is an example of that. I've reviewed the plan itself, but I'm going to very quickly turn it over to the expert, JP, and ask him to give you a presentation about what they put together.
Thank you, Colonel. I appreciate the tee up and then the nice comments, including being the warm-up act. That's always a pleasure. I'm going to share my screen, and if you'll indulge me for about 15 minutes as I walk through the plan that we have developed, which is intended to help fire departments come up with a continuity operation plan. First and foremost, continuity operation plan is an all hazards approach. And it's a large document. It's kind of goes to where the business must go on and where and how and all those type of things. But all we're addressing with the template that we've come up with between IFSI and Mavis is we're addressing the small portion. And we're doing that due to the COVID-19 pandemic and the challenges that you're facing with that. So what we're addressing in the fire department COVID-19 COOP is essential services. Chief Shevlin talked about that. And I'll talk a little bit more in a bit. We're talking about planning discussions that you have to have, addressing the what ifs. We're going to talk about staffing and resources. Chief Shevlin had talked about that. Those are the two key things we've got to look at: essential services, staffing, resources. Apparatus assignments. How do I redeploy my people when I have a decrease in staffing? And then a contingency staffing plan. How do I address those? So I'm going to go through each one of those as we go through here. First off, we've created a simple 9-page document. Why do I say simple 9-page document? When the phone calls started coming in about the COOP is a very large document. And I didn't think fire chiefs wanted to address the entire COOP. I think they wanted to address, from what I heard, was the resources and the staffing. So the purpose is intended to help leaders have the discussion and plan for operational changes due to the COVID-19 pandemic. We're going to face a myriad of issues, from reduced workforces to illness to disruption in EMS supply chain, PPE challenges. But we have to all realize that planning should not occur in a vacuum. You shouldn't do this in your office with your doors closed and not talking to anybody. If you have a labor group, labor ought to be in the table. If you've got an officer group, the officers ought to be at the table. If you've got a command staff group, they ought to be at the table. This is something that brings the group together, and we need to unify in our what ifs and our approach to solving each one of the what ifs. So the first thing is essential services. The first step, you can identify your essential services. Fire departments do many things. We talked about the all hazards approach. But you have to break it down to what are my essential services. Maybe I'm not going to do fire prevention for a while. Maybe I'm not going to do public safety for a while. Maybe I may not be doing car seat adjustments or anything that may be considered extra or nice to have. So I need to identify my essential services. From there, I can then start to identify where I place my staffing. What do I do with staffing when I'm short? Planning discussions, we have to have a large scale what ifs, the potentials of the pandemics. With each what if, we've got to come up with a plan or procedure to develop a way to mitigate the impact on the essential service that we're trying to provide. So some examples of what ifs. In staffing, what's the absolute minimum that I need? How many mutual aid personnel are needed to mitigate? If I called in mutual aid personnel, would it be for a 12-hour period, a 24-hour period? What are my alternate staffing opportunities? If I take my essential services and I say fire prevention is not needed right now or code enforcement is not needed right now, I may reassign those people to the line because that was my essential service. What are my staffing limitations? Do I have a collective bargaining agreement? I certainly should have labor at the table and talking about this as we go through. Even if I don't have a collective bargaining agreement, I have an employee group. I have a group of employees that they want to know what's going on. Should have some employee representatives at the table as we go through this. How are you requesting the additional resources? Am I going to request an engine from a neighboring town for a 24-hour period? Am I going to ask for a complete staffed ambulance? Will I look for singular personnel to staff the apparatus? Do I just need a third person for my backstep person on an engine? And command staff coverage. What do I do if I'm the fire chief and I get sick and my command staff gets sick? How do I have that command staff coverage? Will you require a member of your department to be on the apparatus? So if I bring in people through an intergovernmental agreement, do I allow them to be on the apparatus? Can they drive the apparatus? Do they need to be trained on the apparatus? What are the insurance coverages? A lot of those what ifs. The document you'll see, the picture you see on the right of the screen, that's a U.S. Fire Administration document that's available on the IFSI website. That is some of the information that we used to help create this template. That's a significant document. And as I said, we've came up with a 9-page document, which we think is a simplified version. But if you're looking for details, that publication is an excellent publication. It is linked on the template that we have created between IFSI and Mavis. It's linked to the IFSI website, and you can download it from there. Other what ifs is policies. Can personnel requested from another department, another EMS department with varying medical protocols? and they operate in your EMS system. What are those? As I said before, labor agreements, what adjustments are needed and what adjustments can be made. And again, if you don't have a collective bargaining agreement, you still have an employee group. You still need to reach out to them and talk to them and make sure you're not violating any human resource policies or really good practices about how we treat our people. Workforce protection. What are the PPE requirements? What are administrative controls? Quarantine and isolation policies. Chiefs, if you don't have a quarantine and isolation policy now, you better get one now before it happens, because once it happens, it runs you over. It's too late to scramble once it hits. And the same thing with the COOP. If you don't have one, now's the time to get it, because once it hits, it's too late. You're playing catch up and you truly don't. Housing support. How will I house the mutual aid companies that come in? Will they be in the quarters where the infected personnel are at? Will they be in separate quarters or somewhere else? Health screenings for the employees, or daily health screenings. How are you doing them? Employee testing. How are we getting people back to work? And of course, return to work policies. Resource sharing, intergovernmental agreements, and the MABUS memorandum of understanding to provide staffing apparatus for shortages and coverages. Kevin Line was talking about the ways to get help. And certainly before you go to the county EMA coordinator, you're going to need to be able to show a plan and show that you have used up all your resources and nothing's available. And you've used all those before you just pull that trigger. Communication with the MABUS division president. So where your MABUS division president and also the MABUS branch chief, really important in how you're going to share resources. And as I said earlier, communicating with your EMA manager. Training. If I bring mutual aid personnel in to staff my apparatus, what communications do I use? Are they trained on our mobile radios? Are they trained on our SCBA? Do they know our RIT packs and our response and our deployment plans? Extrication equipment. Have they been trained on the extrication equipment, and what do they know with that? And of course, medical. What are your medical practices? What are your SOPs compared to somebody else who may be coming in from a different region? Housing and food. As you go through the planning and you go through the what ifs is where are you going to house the relief crews? If you had an infected department and say 50% of your department's infected, are you going to put them in the same firehouse that the infected personnel in, or are you going to put them somewhere else? And then will you provide food for the relief crews? Sorry about that. Will you provide food for the relief crews? That's a tongue twister. If so, how? And if not, how will they get food, and how will they cook the food? Finance. We all have to pay the bills. Is your jurisdiction capable of documenting for federal reimbursement? Can local government fund the other agencies? So if Department A is requesting help from Department B, can Department A pay the overtime costs for Department B? Or are they plain broke and they don't have the money in the budget? Do you need to set up an intergovernmental agreement to be able to pay the overtime costs for another department? Are you using an ICS 214 unit log to make sure you're tracking what the units are doing and what they're going along? And of course, public assistance grants. The picture on the side is a public assistance flyer that was sent out from all the fire agencies across the state early on the CARES Act, and how to make sure that you're applying, documenting, and applying for the resources. That's also available via the IFSI website. So I'll go into the template, the COVID-19 template that we've developed. First off, it was designed to be easy to use. We don't want you spending a whole lot of time on trying to figure out lines and shapes and where they go. We wanted to get you through the what ifs and get you into the planning. So the first thing we talk about is the fire department deployment description, the number of firehouses, the number of staffed apparatus, and then your planning assumptions. That really kind of drives what you're doing. Do you assume that you could lose 100% of your people? Do you assume that you can lose 50%? And at each one of those stages, what do you do? So this is what the contingency staffing plan looks like. It's a Word document with a table. and you put in what you're based upon. We based it on 5 tiers, and each tier is a reduction of 10%. That was our planning assumption. And I'll go through how the plan would look. So this is a sample for the XYZ Fire Department with the COVID-19 COOP. So the XYZ Fire Department, they have minimum staffing, and their daily minimum is 16 on duty, assigned to 3 fire stations. They have on 2 engine companies with 3 personnel, 1 ladder company with 3 personnel. They also have 3 ALS staff personnel, staffed ambulances with 2 personnel on each rig. And there's also a battalion chief on the command car by his or herself. And it comes up to a minimum of 16 personnel, and they have 20 total people assigned to shift. So this is the XYZ Fire Department. This is kind of their overview of their deployment. The staffing numbers, and let me see if I can move this. There we go. The staffing numbers, the personnel department is 60. If the personnel were reduced in tier 1 by 10%, we'd have 54. And you can see it all the way goes down to tier 5 at 50%. You can see our planning assumption here is that we're going to lose 50%. That's the maximum we'll lose at department. You can change this. You can say, I'm going to plan for 100%. I think that's a good idea. We set up the template here so you can see what it is, and then you can make those decisions. The next part is the daily staffing. I have 3 staff fire apparatus, 3 staff ambulances, and I also have a battalion car that gets me the 16 personnel. And as I said, the planning assumption is that 50% of our staff will always be available. You can make that 100%. You can do whatever you want to do. We've created the template and given you the ideas on how to do the planning process. The contingency plan. So here is if we look at the scheduling. The overtime here, scheduling, if I'm at 10%, I'm just filling my vacancies with overtime. No staffing change. At 20%, I'm doing the same thing. At 30%, I'm doing overtime and a reduction of a company. So when I get to 30%, I'm going to reduce one of my companies. When I get to 40%, I'm going to use overtime. I'm going to cancel my benefit time. So vacation days, Kelly days, school days, training days, whatever days I have, those are canceled. And I'm going to reduce a company and an EMS unit. So I have 1 fire unit, 1 EMS unit out of service. I get to 50%. I'm going to stay with the changes I made in tier 4. And then I'm going to increase mutual aid for response for coverage. So increase my request for mutual aid, increase with talking to my neighbors. My minimum staffing, as you would see for those reductions, when I'm at 10%, I stay at 16. It's when I get to 30% that I start to reduce my minimum staffing. To where in the end at 50%, my daily minimum staffing is at 9. Staffed apparatus. In here, I delineate here in what are my staffed apparatus. As I get to 50%, I go from three companies, 3 fire companies, 3 EMS units at 10%. And at 30%, I drop down to 2 fire companies and 3 EMS. At 40%, I go to 2 fire companies and 2 EMS. And at 50%, I go to 2 and 2. Again, these are decisions you have to make as the chief. We're putting together the template that say, hey, these are some ideas for you. Response mode through 20%, I'm unchanged. At 30%, my outgoing automatic aid for fire responses is reduced. So I've reduced a fire company, so I'm not going to be sending out automatic aid. I need to be talking to my response partners. I got to be talking to my fellow chiefs in the Mavis division and anybody who I have auto aid agreements in, telling them I'm not able to respond. At 40%, I'm going to the outgoing automatic aid and fire response is reduced again. And then at 50%, I'm canceling all outgoing automatic aid. Additional responses through 30%, I start to receive increased mutual aid or mutual aid. I start to increase that. I increase my auto aid, at 40%, and I increased it at 50%. So I'm talking to my neighbors and saying, I need help. I'm down, down 50% of my personnel. Maybe I'm down 100% of my personnel. But these are the planning discussions we want you to have as you go through the template. Intergovernmental agreement requests, not required through 20% reduction at 30%, possible change in my auto aid agreements. I need to either increase coming to me and decrease going away. At 40%, I've asked for one staff DMS unit for a 24-hour period. That was in my intergovernmental agreement. And then at 50%, I've asked for one fire unit and one EMS unit on a 24-hour basis. So somebody's sending to me one of their fire engines and one of their ambulances on a 24-hour basis. Housing, well, it's all the way through 30%. We don't believe it's required because you're using your own staffing. But one of the things that we considered was if I'm a neighboring fire chief and I'm sending you a fire engine and I'm sending you firefighters, do I want them going into the house that was infected where people got it? So I have to consider an alternate location. And then at 50%, probably I'm going to require a special separate change of quarters for coverage to make sure that I'm not cross-contaminating personnel and sending back the personnel to the neighboring chief who was kind enough to loan me his personnel, sending them back infected with COVID. And then meals. At the 40% level, again, this is depending on where they're at. Am I going to provide meals? At 50% probably is required because we want to make sure that we're able to feed them, but we're not going to have them in a firehouse. So these are things that you should consider in your COOP. And then others, of course, we want to document costs. We want to consider moving staff personnel at 20%. I want to take my support staff, if they're qualified to be out on the line, put them out on the line. If I can designate auto aid resources, consider reduction of benefit times. I can work with my labor groups to, I'm going to have to hold back on Kelly days or hold back on vacation days so we can keep staffing. Of course, there's all those parts of labor agreement and human resources that we still have to treat our people properly. And then at the end of 50%, we place the shift commander on the fire company and we take an admin chief and put the admin chief becomes a shift commander and running for incident command. So that's a quick down and dirty of our contingency plan. Additional resources at the end of the template, we have additional resources that provide a lot. There's a lot of excellent resources out there for the COVID information, for planning, for COVID plans. We tried to simplify as much as we could. Some of the things we took are from the sources that you'll see there, and that's also in our template. Our template's available at the IFSI website under the COVID-19 in the public assistance area. That's me. That's my office number, my email address. If I can be of any assistance to anyone in helping explain the document, helping you get the document, or help you through one of the what ifs, myself and anybody else at the Fire Service Institute and at MABUS is here to help. With that, JC, I say thank you for the time.
Thank you, Chief. We appreciate it. Thanks, Director Mortensen. It's always a pleasure to work with you, gentlemen. You guys are consummate professionals, and it's always nice that the Illinois Fire Service Institute is involved in these. And so we appreciate it. If you guys have any questions, like I said, please send them to me. You can find me at jc.fultz, F-U-L-T-Z, at illinois.gov, or on the side of your screen, you'll notice a chat feature, and you can type in your questions down there. And so far, we don't have any questions yet, so all of you guys are doing a phenomenal job tonight on this. I'd like to introduce Chuck Sullivan, President of the Associated Firefighters of Illinois. And President Sullivan, it's all yours.
Thank you, JC. How's the audio? Can you hear me okay?
It's good. You look good. You sound good.
Good. Thank you. I thank Fire Marshal Perez for coordinating and setting this up. It's obviously very beneficial to the fire service. And so FFI, as many of you know, it's a labor organization. We represent over 15,000 firefighters and paramedics in 225 communities across our state, ranging really from units with 3 full-time firefighters to about 4,500 firefighters in Chicago, and honestly, everywhere in between. I think our average local union is about 37 members. So now I realize that I am speaking to a narrowly focused audience of union firefighters, and my comments obviously are representative of a labor organization representing firefighters and paramedics. So I will start with this. We are fortunate as firefighters to live and work in a great state like Illinois, where we have the opportunity to collectively bargain a contract with our local government employers. And again, just to refresh everybody's memory, each one of our 225 local affiliates have local autonomy, and they determine their contracts. And obviously, that's within the parameters of the law. So I would suggest that if our local unions haven't already, now would be a really, really good time to review your contract, see if it has an emergency clause. Some people call it a force majeure. I've heard Margaret and Jerry, our attorneys, say that over and over the last 6 months. I thought I'd try to say it and sound cool. But if your contract has that, it indicates that there's a civil emergency declared by the manager or mayor. So they could very well suspend your bargaining agreement to respond to the crisis, as long as your wages and benefits are not affected. So I can also assure you that if the state declared an emergency, the employer is probably going to have some leeway in how it deviates from your bargaining agreement. I can also tell you that each one of us took an oath and swore to protect the citizens and the visitors and property in each one of our communities. And I know that we take that really very serious. So we at the AFFI are confident that each one of our affiliates will do really whatever is necessary to provide the best service possible to our citizens. Now, having said that, we as a union believe it's obviously necessary to ensure the safety and health of our members is still the #1 priority. And really, that's why we agree with the fire chiefs, Mavis, and everyone else on this panel, that it's imperative that if you don't already have a plan in place, should your department be impacted by COVID, one should be put in place really as soon as possible. So if your department doesn't have one in place, we, again, at the AFFI encourage our locals, sit down with management, discuss various scenarios, as Chief Moore has demonstrated, that could very well take place due to COVID, create a memo of understanding, a variance agreement. If that means you have to file a demand of bargain over staffing issues or vacation issues or increased hours, do so in order for your department and really your members to be prepared. So now, obviously, there's a multitude of other items that are COVID related, and Chief Moore touched on them in his presentation. For our members, there's return to work guidelines, there's testing, there's job related exposure, there's sick leave usage, et cetera, et cetera. So this COVID Mayday forum revolves around what to do if a significant percentage of your members have tested positive and are quarantined, and what steps need to really be taken in order to continue to provide what we all consider the exceptional service that we do on a daily basis. So we have 5 AFFI district vice presidents that stand ready to assist each of our affiliates with issues that may arise. We also have an AFFI COVID-19 committee that's been active since early March. They've been researching and updating various guidelines that we obviously have to adhere to. In addition, again, I know Chief Moore indicated in his presentation, we have an AFFI website, a page dedicated specifically to COVID that you can use as a resource. So really, I guess just to summarize, if your department doesn't have a plan in place, we strongly encourage you as union leaders to work with your administration and get one. not only for the citizens that we protect, but really just as importantly for us as firefighters and paramedics. So thank you, JC.
Thank you, President Sullivan. We really appreciate that. And with that being said, if you have any questions for us, which right now we don't have any questions in the chat or on email, you can always reach out to us. One of us who is presenting tonight will get back to you. We'll get you the information. Or if you want to send me some questions, if you think about it, you have my contact information, jc.fultz@illinois.gov, or on our chat feature here in the next couple of minutes before we wrap up. Please do so. I can direct those questions to wherever they need to go as well. Any of the presenters tonight, do you guys have anything else you want to talk about before I give it back to Fire Marshal Perez? I see lots of head shaking, so that's a good thing. Well, we really appreciate everything you guys have done for us tonight as well. So Fire Marshal Perez, I will give the floor back to you, sir.
All right, thanks, JC. And just to follow up on everything Chuck was saying, obviously the AFFI is looking out for their members, but there are rights that all firefighters have statutorily in Illinois that cover workers' comp and sick time, things like that. So as Chuck says, please look at that aspect also outside of the kind of the disaster thing that the COOP will cover. A lot of details there, but there is coverage. So like I say, even the smallest departments, I would pursue that for your guys if they do get sick. As the coronavirus continues to impact the communities and the fire services across the state, I'd encourage everyone to act on the information that was presented today. Great presentation by Jimmy and great information by the rest of the crew. I'd also encourage you to continue following the guidance issued by IDPH, CDC, and your local health departments. Wash your hands, practice social distancing in your firehouse, wear your mask, and if you're sick, stay home. That's pretty simple, but effective. The Illinois Fire Service is very diverse, but the good thing is we're even more dedicated than we are diverse. I'd like to thank the Illinois Fire Chiefs Association, Illinois Fire Service Institute, MABUS, and the Associated Firefighters of Illinois for coming together to breathe life into our motto of one team, one fight. In the hardest times, it's obvious that we'll only have each other to rely on if we stay together, being our brother and sister's keepers. So again, I really appreciate all the effort that went into tonight by all the presenters. And I thank everybody that tuned in for this live, and also thank everybody that will tune in later to watch us. And thank you for your continued dedication to protecting each other and residents of Illinois. So with that, I'll kick it back to JC and wish everyone to stay well.
Thank you, Fire Marshal Perez, and thanks to everyone who tuned in tonight. Like Fire Marshal said, we're going to make this presentation available for you all. It will be available at our Facebook page, on our website, sfm.illinois.gov, and I'm also going to put this on our Twitter page as well. So thanks, everybody, tonight. Thanks to all of our presenters. Again, if you have questions, you can send them to me. I'll make sure they get to the proper people, or you can send them to the presenters themselves as well. All right, everybody, have a great night. Stay safe, stay well. Take care.